So the challenge from a system-wide risk management point of view is understanding how organisations and what they can do, but also what they can't do and what they need to bring in from the system. So we're not in isolation as an acute trust or a mental health trust. We work with ambulance services, we work with local authority, we work with third sector organisations, nursing homes, and to have a system-wide approach to risk is crucial to understanding what that actually risk means, but also what we can do about it as a system rather than as an individual organisation, because together you're much better at managing and reducing that risk. So for me, the biggest thing about embedding governance and safety and risk in day-to-day practice is very much around the capacity of wards, teams, services. They've got so much to do. Capacity is at its fullest and then some, and actually there's not enough time for them to stop and think and reflect about adverse events, about how we can improve, how we can learn. They're just concentrating on very much keeping afloat at the moment as an organisation, and that's the opportunity, but also it is a risk because you don't have that breathing space as a team leader or a ward leader to understand what are my risks, but what can I do about it and how can I improve from that point of view. You know, what's the data telling me? So for me, the advice I would give to any peers who are working in the system about managing risk is to not stop and think about just the classical data and information that you have. So not just looking at your adverse events, not just looking at your complaints, but also looking at other types of reporting processes as well. Staff experience is a really vital and important thing to pick up on. So what are local surveys or pieces of information to come up with? Freedom of information requests, for example, can be one thing, and also around understanding what we see from requests from commissioners, from your CQC, from other regulators that you have to work with as well. What does that all information tell you? Sometimes it's a challenge, but it's a real big opportunity to step back and see it from a wider perspective. What is all this data telling me? Not in isolation, because it probably doesn't pick up a risk, but actually cumulatively it will teach you and tell you a big risk which you never would have seen had you just concentrated on one, two or three of those particular pieces of information.